Hello and welcome back to the EquiHerbal podcast where we discuss all things herbs and horses to help you and your horse live a happy, healthier life, naturally. I am Kayla Dendy, your master herbalist, and today I will be discussing bilberry, an herb sometimes confused with bayberry, which was the topic of a previous episode, and barberry, an herb that was discussed in last week's episode. As always, please speak with your doctor or veterinarian before utilizing herbs or alternative medicine. This podcast is for informational purposes only and is not intended or designed to be a substitute for qualified medical advice. Introduction. Bilberry has a long history of use and has been referred to by many names including whortleberry, black whortles, winberry, trackleberry, huckleberry, bleaberry, and hurtleberry, among others. Its Latin name is Vaccinium myrtillus. The bilberry plant is a low-growing shrub native to northern Europe, but is now also found in parts of North America and Asia. It belongs to a large genus of plants that also contains blueberry and cranberry. Bilberry is sometimes called blueberry because both have similar appearance and are close relatives, but the true blueberry is native to the United States. Bilberry usually grows in heaths, meadow, and moist coniferous forests, and its growth is favored by moderate shade and moderately humid ground conditions. The bilberry is a small, 5 to 9 millimeter in diameter fruit, bluish-black in color, with many seeds. Bilberry is classified as a Class 1 herb by the American Herbal Products Association, meaning it can be safely consumed when used appropriately. No mutagenic activity has been reported, and there are no cited contraindications to its use. Bilberry is sold as fresh, frozen, and dried whole berries, as well as in the form of preserves, jams, and juices, and increasingly, liquid or powdered concentrates are sold as food supplements. Plant description. Bilberry is a small branched shrub with wiry angular branches, rarely over a foot high, bearing globular wax-like flowers and black berries, which are covered when ripe with a delicate gray bloom, hence its name in Scotland. Bleaberry, from an old North Country word, blay, meaning livid or bluish. The name bilberry is derived from the Danish bullabar, meaning dark berry. There is a variety with white fruits. The leathery leaves, in forms somewhat like those of the myrtle, hence its specific name, are at first rosy, then yellowish-green, and in autumn that turn red and are very ornamental. They have been used to flavor tea. The fruit is globular, with a flat top, about the size of a black currant. When eaten raw, they have a slightly acrid flavor. When cooked, however, with sugar, they make an excellent preserve. In England, they are often used to color wine. Parts used, the ripe fruit and the leaves. History. Bilberry has been used as food for centuries. Bilberry's history of medicinal use dates back to the Middle Ages, but it did not become widely known to herbalists until the 16th century, when its use was documented for treating patients with bladder stones, liver disorders, scurvy, coughs, and lung tuberculosis. One of the most recent advances in the use of bilberry was found during World War II. The story goes that British RAF pilots were using bilberry jam on their bread. It was noted that these pilots seemed to be far more successful at hitting their targets. After research was done on the use of bilberry in the use of eye disorders, it was found to help against fatigue, reduce eye irritation, nearsightedness and night blindness, extend the range and sharpness of vision, aid in the adaptation to darkness by accelerating regeneration of the retina, and help to restrain the development to conditions such as glaucoma and cataracts. Subsequent research revealed that bilberries are powerful antioxidants, capable of protecting cells in the eye and other parts of the body against damage from free radicals. Constituents. Bilberry is currently best known for the properties of the anthocyanidin, Greek anthos, flower, and kyanos, blue, and pro-anthocyanidin content of the fruit. Anthocyanidins and pro-anthocyanidins are naturally occurring polyphenolic flavonoids widely present in berries and other fruit, also responsible for the blue-red pigmentation in many flowers and fruits. The chemistry and biological activities of the anthocyanidins and anthocyanins have been extensively studied. Bilberry is one of the richest natural sources of anthocyanins. Bilberry has a higher anthocyanin content compared to other types of berries, such as strawberry, cranberry, elderberry, sour cherry, and raspberry. Anthocyanicide flavonoids, vitamins, sugars, and pectins are found in the berries. Quercetin, catechins, tannins, iridoids, and acids are found in the leaves. The anthocyanins are considered the most important active components. Anthocyanins have been shown to have anti-ulcer activity, making plants containing these constituents beneficial in cases of acute gastric ulcers and in cases of chronic ulcers. Anthocyanin concentration in the fresh fruit is approximately 0.1% to 0.25%. Concentrated bilberry extracts are usually standardized to 25% anthocyanins. The berry's anthocyanin content increases as the fruit ripens. The reverse is true of its leaf constituents. Although the function of anthocyanin pigments in plants is thought to be mainly that of attracting animals, insects, and birds for pollination or seed dispersal, anthocyanins may help in cold tolerance as well as antimicrobial and antioxidant defense of plant tissues. The anthocyanin content of berries varies across species and also depends on environmental factors, such as the amount of solar radiation, temperature, and soil content of nitrogen and phosphorus. The cultivation technique is also a factor affecting the total phenolic level of berries. Anthocyanins are found mainly in the skin of the berry, and damage to the fruit skin caused during harvesting decreases anthocyanin content. Degrees of ripeness of berries also contribute to variation in total phenolic content. Although the concentration of phenolic compounds is usually higher in unripe berries than in mature fruits, anthocyanins accumulate during bilberry maturation. Anthocyanins have powerful antioxidant properties, and the content of anthocyanin pigment directly correlates with antioxidant activity of plants. In addition to the antioxidant effects, anthocyanins have been reported to stabilize DNA, modify adipocyte gene expression, improve insulin secretion and sensitivity, and have anti-apoptotic, anti-inflammatory, and antibacterial effects. These numerous and potentially highly beneficial effects of anthocyanins make foods rich in these compounds, such as bilberry, potential candidates as functional foods and phytotherapeutics. Clinical uses. The fruits are astringent and are especially valuable in diarrhea and dysentery in the form of syrup. The ancients used them largely, and Dioscorides spoke highly of them. They are also used for discharged and anticoagulants. A decoction of the leaves or root bark may be used as a local application to ulcers and in ulceration of the mouth and throat. The fruit is also helpful in cases of scurvy and urinary complaints, and when bruised with the roots and steeped in gin, has diuretic properties valuable in cases of swelling under the skin, sometimes called dropsy. A tea made of the leaves has also been used as a remedy for diabetes if taken for a prolonged period of time. Bilberry extracts are widely used in Europe for the treatment and prevention of secondary eye problems in people. The berry, rather than the leaf, is more beneficial in this application. Bilberry fruit has long been used as a mild laxative because of its sugars and to relieve diarrhea due to the tannins. It is also moderately antibacterial, and since it tastes pleasant, is useful for treating diarrhea and indigestion in children. Bilberry is recommended as a remedy in prolonged diarrhea or vomiting, as a mild vermifuge, dewormer, and remedy for throat ailments, and as a nerve tonic for animals. The German literature describes use of 10% dried bilberry fruit decoction as a safe supportive treatment of non-specific diarrhea, including pediatric cases, and for topical inflammations of the mouth and throat, including oral candidiasis, yeast infection, thrush. These uses are not widespread in North American clinical practice and are unlikely to cause any interactions with pharmaceutical agents. Concentrated extracts are indicated for microcirculation disorders affecting eye neurovasculature. Bilberry improves blood circulation by increasing the ability of fluids and nourishment to pass through veins and capillaries. Conditions such as optic neuritis of multiple sclerosis, macular degeneration, glaucoma, and diabetic retinopathy are common indicators for the use of bilberry. Many circulatory disorders will benefit from the fruit's ability to improve capillary function and heal inflammation. These include Raynaud's disease, varicose veins, hemorrhoids, and easy bruising. Bilberry is a beneficial herb to use during pregnancy. It can be strong but gentle astringent and will fortify vein and capillary support, aids in kidney function, and is a mild diuretic for bloating. The leaves have a marked antiseptic effect within the bladder and urinary tubules, and can be used to treat urinary infections such as cysts. Non-medical uses. Stewed with a little sugar and lemon peel in an open tart, bilberries make a very enjoyable dish. Before World War I, immense quantities of them were imported annually from Holland, Germany, and Scandinavia to England. They were used mainly by pastry cooks and restaurant keepers. Owing to its rich juice, The bilberry can be used with just a small amount of sugar to make a jam. Half a pound of sugar to a pound of berries is sufficient if the preserve is to be eaten soon. The minuteness of the seeds makes them more suitable for jam than currants. Research. In a 1927 study, the herb was shown to reduce high blood glucose levels in normal and diabetic dogs, even when glucose was injected at the same time intravenously. Currently, bilberry research is focused on the treatment of patients with ocular and vascular disorders, diarrhea, dysentery, and mouth and throat inflammation. Bilberry leaf decoctions have been used to lower blood sugar and diabetes. Clinical trials from 1964 onward have shown that bilberry fruits protect peripheral circulation and capillaries. Symptoms that have been shown to improve with bilberry extracts include fluid retention, pain, pins and needles, paresthesia, and cramps, all resulting from impaired peripheral blood flow. Recently, a study examined the impact of bilberry extract and vitamin E supplementation to rats to determine if the extract could prevent the development of early senile cataract and macular degeneration. 3 months into the study, it was seen that more than 70% of the control rats had developed cataract and macular degeneration. The supplementation of bilberry extract completely prevented impairments of the lenses and retina. Vitamin E supplementation had no significant effects. This study suggests that long-term supplementation with bilberry extract is effective in the prevention of macular degeneration and cataract. Genoprotective and anti-cancer effects. 1 in 3 people will receive a diagnosis of cancer at some point in their lives. Treatment of cancer is harsh and often unsuccessful. Cancer is a disease caused by mutations in key genes controlling cell division and growth. Damage to DNA increases the likelihood of such mutations, and any bioactive food or component that is found to protect DNA from damaging agents, lower baseline DNA damage, or increase DNA repair is a potential cancer-preventing agent. Although damage to DNA can be of many types and can result from many different processes and agents, oxidation-induced damage is thought to be a key factor. Chronic inflammation is a cancer risk factor. Diet is an important modulator or cancer risk factor. Berries have anti-cancer potential, and there are some data from experimental studies that have used bilberry alone or in conjunction with other berries. In vitro work and animal tumorigenic models have demonstrated that berry anthocyanins have cancer-preventive and suppressive activity via antioxidant activity, anti-proliferative, apoptotic, anti-angiogenic, and anti-inflammatory effects, and induce the antioxidant response element with consequent phase 2 enzyme induction and other cytoprotective effects. Other mechanisms of genoprotection may involve direct interaction of anthocyanins with DNA. Natural anthocyanins have been reported to intercalate with DNA, forming a DNA copigmentation complex. This triplex stabilization property suggests that anthocyanins could help regulate gene expression in addition to protecting DNA against oxidative damage. Anthocyanins have been shown to protect DNA against oxidative stress induced by various agents, UV irradiation, hydrogen peroxide, in vitro. However, it is noted that the doses for in vitro studies are much higher than values that can be reached in plasma through the dietary intake of anthocyanins. In animal feeding studies, cancer chemopreventive and therapeutic effects of anthocyanins in berries have been shown in various models. Interestingly, a commercial anthocyanin-rich extract from bilberry was shown to inhibit growth of colon cancer cells, but did not affect growth of normal colon cells, suggesting a possible specific action against cancer cells. Among the ethanolic extracts of 10 different berries tested for induction of apoptosis in human cancer cells, bilberry extract was reported to be the most effective. Cardioprotective effects. All over the world, CVD is a leading cause of death. Major risk factors of CVD include central obesity, diabetes, hypertension, elevated levels of lipids, and high levels of uric acid. Increased oxidative stress may also contribute, and inflammation is a key factor. Atherosclerosis, the main underlying factor in CVD, is an inflammatory process associated with oxidative processes in and damage to the vascular endothelium. Therefore, the anti-inflammatory and antioxidant effects of anthocyanins are of relevance to potential cardioprotective effects of bilberry and other berries. A controlled human supplementation trial showed decreased concentration of inflammatory biomarkers in the plasma of 31 subjects who took bilberry juice for 4 weeks. In a controlled human study of 35 subjects who took 100 dries of whole bilberries each day, platelet function, blood pressure, and high-density lipoprotein, HDL, cholesterol were all improved. In another human study, mixed anthocyanins from bilberry and blackcurrant were given as an extract, 320 mg a day, for 12 weeks to 60 middle-aged dyslipidemic Chinese subjects. Results showed significant improvements in low-density lipoprotein, LDL, cholesterol, and HDL cholesterol. Regarding blood pressure and vascular health, bilberry fruit anthocyanins have been reported to inhibit smooth muscle contraction and platelet aggregation. These are potentially antithrombotic and antihypertensive effects and have cardioprotective effects. Hypoglycemic effects. The bilberry plant is reputed to possess anti-diabetic properties, and its berries and leaves have been used for centuries to ameliorate the symptoms of diabetes. In a survey of 685 herbalists, bilberry ranked 4th in a list of herbal remedies recommended for improvement of glycemic control. The reported hypoglycemic effect of bilberry is a desirable effect for helping to prevent or control type 2 diabetes. Although there are some published human studies of the hypoglycemic effects of bilberry, strong evidence from human trials is lacking. To my knowledge, there are no published controlled human studies with bilberry on diabetes patients. The 2 published human supplementation studies with bilberry studied subjects at elevated risks of CVD, but they were not diabetic. Although we lack human data on the anti-diabetic effects of bilberry, numerous in vitro and animal studies provide good evidence of a role for bilberry in treating and preventing type 2 diabetes. Herb-drug interactions. Interactions between standardized bilberry extracts and pharmaceutical drugs have received minimal study. Cautions. Bilberry is a very safe herb. For examples, dosages as high as 400 mg of body weight have been administered to rats without any toxicity. Long-term oral administration in humans with doses equivalent to 180 mg anthocyanins per day for 6 months produced no toxic effects. No mutagenic or carcinogenic effects were observed. Bilberry extracts have antiplatelet aggregating properties. Because of this, very high doses should be used cautiously in patients with hemorrhagic disorders and in those taking anticoagulants or antiplatelet drugs. A review of studies comprising more than 2,000 subjects who took bilberry extract reported only mild adverse effects that affected the GI, cutaneous, and nervous system. Thank you for joining me for today's discussion on bilberry. I hope you found it interesting and learned a little bit about just how wonderful this herb is and its various uses. Next week, I will discuss black cohosh. I hope you take time to tune in next week for that discussion. As always, this podcast is for educational purposes only. The information contained in this podcast is not intended or designed to treat, cure, or prevent any illness or disease. This podcast is not designed as a substitute for advice from your medical provider, veterinarian, or other qualified healthcare professional.